You're listening to Health Professional Radio. My name is Wayne Bucklar and my guest today is Bruce Nixon. Bruce joins me from Canberra in Australia. He is the CEO of Holocentric. Bruce, welcome to Health Professional Radio.
Yeah, thank you, Wayne. Pleasure to be here.
Now, Bruce, Holocentric isn't a name that immediately describes what it is you do. Can you share with us what it is you do and what the product set is?
Yes, certainly, Wayne. So we provide software that helps to reduce the complexity in organisations so they can be more effective, meet their compliance obligations, and most importantly, particularly in the current times, to be more responsive to change. So
that's an enterprise-wide solution?
Yeah, we take a holistic approach because we believe across organisations that everything is connected. You know, the effectiveness of the organisation is determined by the weakest link, really. So how do you make sure that you can be effective across the organisation by getting a greater understanding of how all the activities that you perform work together to deliver a much better outcome for, particularly in terms of our customers.
Now, the health sector, as you'd be well aware, is a horribly complex beast, and sometimes I describe it as being the last great cottage industry. Is this something that a hospital would use?
Possibly. We tend to work more with some of the government organisations. So the organisations who create policies and create the appropriate procedures. And so, for example, we're working with the National Disability Insurance Agency to help them capture the operating model for the National Disability Insurance Scheme so that can be more effective in the way that operates. So in designing that, what are the different parts of that scheme and how should they work together most effectively to actually deliver the ultimate result? So, and some of those then might be service providers that we also are starting to work with who work within that scheme or might work within aged care, for example, in providing services in that arena as well.
And we do get a fair part of our audience are involved in aged care, and that again is as complex as a hospital, or more complex in some cases, I guess.
Yeah, I think in any of those types of environments, there's a great deal of complexity, and it looks like that's increasing rather than reducing. As change comes along, then people need to respond to that and work in a different environment from what they've been working in the past.
And so the scale of your customers, I mean, NDIS is a great big government enterprise. How small can you go down to and practically be of use?
Yeah, I think in any organisation, once you get over any number of people, but over about 100 people, you start to get greater complexity. So as organisations grow bigger and bigger, the number of combinations of the way things may be enacted increases exponentially. And so the very large organisations are horrendously complex, but even some of the smaller ones still have to deal with a lot of complexity in relation to different compliance obligations, different schemes they work with, different procedures they need to follow, the different skill levels they have within people, and the training of those people and how they utilise systems most effectively. So it can be applied very well down to the smaller organisations of, say, 100 people or less as well.
So what would be the kind of trigger that would occur for a potential customer to ring you up and say, we need some help? What sort of organisational behaviours or characteristics occur that would make people turn to you for the benefits you can bring?
Yeah, typically there is some sort of catalyst, such as a change to a funding model. So in aged care, for example, going from a block funding model to a consumer-oriented funding model is a significant change for the industry. And how do you respond to that? Do you need to change your business? Do you need to rethink the way you provide customer service as part of that new operating model? With greater competition out there, is that going to change the way you need to behave, the way people need to think to make sure you get better alignment in the way you work? So there's something like that typically that is the incentive for people. Well, of course, with the NDIS, people now need to register for that. So the service providers need to work within a scheme, need to understand how those rules apply, how the plans are developed by the local area coordinators or by the NDIA themselves, and what that means for the participants in the scheme. So how do they operate, how do they provide the services, and making sure they have a much more customer-oriented service delivery model in their organisations.
Now, Bruce, for those people who are looking at needing to do something about reorganising their business models, how do they get in touch with you?
Well, We provide services directly to our clients, so they'll often come to us through our website, which is www.holocentric.com. They will be referred to us quite often by other clients who we're working with who have similar experiences or needs in their industry, and sometimes through our business partners who we're starting to work with.
And so that website, www.holocentric, HOLOCENTRIC.com.
That is correct, yes, that's your point.
Now, if you've just joined me, you've missed my conversation with Bruce Nixon, the CEO of Holocentric, where we've been talking about what Holocentric can do and how it can assist as a piece of software and a system, particularly for larger organisations in health who are looking at needing to redesign business models or redesign processes and compliance. The good news is we have a transcript on our website. We also have an audio archive of our conversation on SoundCloud, and you can access both of those at the Health Professional Radio website at www.hpr.fm. Bruce, I do appreciate your time. I know you're a busy man, and I appreciate you giving HPR some time today.
It's been a pleasure, Wayne. Thank you for the opportunity.
You're listening to Health Professional Radio. My name is Wayne Bucklar.